South Dakota Republican Senator John Thune is chairman of the Senate Republican Conference. He joins us tonight from Capitol Hill. Senator, thanks for being here. What's your take on the chances of all of this coming together, repeal and replace at the same time?
I think they're very good, Brett. You have a unity among the new administration, House leadership, Senate leadership, that we need to get this done. This is a promise we made to the American people. It starts with repealing Obamacare and then obviously replacing it with something much better. We believe that we want to come up with health care coverage that is personalized, it's patient-centered, and it's affordable to every American. And last night's vote was the starting point of that process.
Here are two House Democrats talking about what they believe, what they're hearing from some of their Republican colleagues.
Now they're shooting with real bullets at the Affordable Care Act. And a number of senators in particular are really starting to get cold feet.
Repeal and replace has only alliteration going for it. It's alliterative, but it's not realistic.
Senator?
Well, look, Brett, we'd be having this conversation if Hillary Clinton had been elected president. 8 out of 10 Americans believe that Obamacare either needs to be repealed and replaced or significantly changed. It is imploding. Premiums are soaring, markets are collapsing. There are a third of the counties in this country only have one option when it comes to insurance, and people's choices are dwindling. So this was bound to happen. The only question now is whether or not Democrats are going to play a constructive role and work with us on putting in place a new health care coverage system that, as I said, is personalized, patient-centered, and more affordable. That's the key. The key issue for most Americans right now is they want something that's affordable, and they don't have it today because of these out-of-pocket costs with Obamacare.
Right. We've done many stories about deductibles being really high, about premiums being really high across the country. But what about what is liked, at least according to the polls, in Obamacare, that the pre-existing conditions element and the fact that you could have your child stay on your plan till 26 years old?
Well, there are some features, Brett, of the current plan that could be retained. But we believe that there's a better way to do some of those things. I mean, having Washington Central planning with this overly prescriptive approach, for example, to covering people with pre-existing conditions, isn't the right approach. We think that high-risk pools that are administered by the states, giving the states more flexibility to design programs that fit their constituencies, gets you a much better outcome. And we also believe that you got to create more competition out there in the marketplace. More competition, more choices drives prices down. So there may be some things that we can work with, but by and large, we just believe we need a whole different direction, a whole new model about how we deliver health care coverage or make it available to people in this country in a way that's affordable.
I mean, I get that point, but are the specifics nailed down? Are Republicans singing from the same sheet of music when it comes to what the end bill is going to look like?
You know, there are lots of Republicans are an entrepreneurial party. We have people with lots of good ideas. We're all agreed on the goal, and the goal is repeal what we have, replace it with an alternative that's much better. And there are a lot of pieces of legislation that we will pull together, and it may come together in terms of the repeal vote that we'll have here in a few weeks. It may be partly administrative action by the new Health and Human Services Secretary, Tom Price, when he gets over there. There's going to be another opportunity later this summer. This is a process of transitioning away from what we have, which has failed, it's broken, we know that, and going to a better place and a better type of coverage for people in this country. So yes, there will be, when we come together behind a plan, it'll have blocks and pieces that have been introduced by many of our members, most of which I think will be agreed upon by both senators in the House and the Senate on the Republican side. I'm just hoping that there are going to be some Democrats who will work with us, because we all know that one of the reasons Obamacare was such a failure is it was pushed through on a party line vote. We need people involved to try and solve this problem for the American people.
Here's a senator who won't work with you, Bernie Sanders. Take a listen.
Medicare will be converted into a voucher program. Medicaid will be decimated. Rural hospitals will be closed. And they have no alternative proposition. They want to kill ACA, but they have no idea about how they're going to bring forth a substitute proposal. This is not what the American people want. This is irresponsible. This is dangerous. This should be defeated.
So isn't it dangerous politically if you don't lay out specifics and this kind of drags on the replace part? The repeal's obviously there, but the replace part, House Speaker Paul Ryan said that there's no timeline on that.
Well, and I think what people need to understand is, and these scare tactics are to be used by the Democrats. First of all, we're not talking about Medicare at all here. So his speech last night was completely off the mark. But more importantly, this is a transition, and people need to understand if they have coverage today, it's not like they're going to lose it tomorrow or somebody's going to pull the rug out from underneath them. This is something that will take some time to implement. They'll be phased in and phased out, and we want to make sure we get it right. You know, we're not going to fix this overnight. We didn't get to this failed, broken system overnight. It took the Democrats who voted for this thing and the president who implemented it a long time to get to where we are today. So it's going to take some time to get this repaired, but we're beginning that process. It starts with repealing the current system, and then over a period of time putting new solutions in place, perhaps implemented over the next several months, but certainly in an end place that is much better for the American people and gives them more choices, more options, more competition, and lower prices.
Last thing quickly, Senator, is there leverage in the Democrats who are up for re-election in 2018 in red states? Do you sense that that you can somehow get them to sign on to what the replace is?
Well, as you know, Bret, President Trump won with big margins in a lot of those states where we have Democrats running for election in 2018. And there are places in the country who have been really harmed by Obamacare as it exists today. So I'm hoping there will be an appetite among Democrats to play a constructive role. We will certainly reach out to them. That's not something that they gave us the luxury of when they passed this 7 years ago. But we believe it makes sense to try as hard as we can to come up with a bipartisan product where you've got buy-in from both sides, because I think that is much more durable. So we will test and see whether or not there is an appetite among Democrat senators and House members to be a part of a solution to fixing what is a clear problem, well documented, and very much apparent to the American people.